All right, well, it's Medical Monday in Wisconsin tonight. Joining us right now, Dr. Brian Klinka from Bay Care Clinic, here to talk about hand conditions. Now, these can be pretty serious with people that use their hands, carpal tunnel and everything, but enough about them. I've got these unbelievable pains in my thumbs, okay? Like unbelievable. What can I do about them?
Well, you can come and see us.
Okay.
We definitely like seeing patients earlier than later. There's a lot of different options that we have. I treat hand, wrist, elbow, shoulder issues. We see arthritis conditions, tendinitis conditions, nerve conditions like carpal tunnel syndrome. A lot of these conditions we can treat with non-operative methods first, like steroid injections, therapy, activity modification. But ultimately, if those fail, we have to talk about surgical options.
Well, that's the thing, though, and so many people, I know people that work in offices that can't work anymore because of the carpal tunnel syndrome. I mean, that's a real serious, painful thing, isn't it?
Exactly. It's a real entity, and it affects a lot of people. We have a lot of great options, though, like I mentioned. People are able to get excellent recovery, excellent functional recovery with a lot of the efforts that we give. What
would be some of the symptoms of just, overuse versus a serious problem starting up?
So an overuse injury is something that we say is more chronic in nature. It's usually a repetitive type issue that brings it on versus an acute injury is something that is entirely new. It's often a fracture type situation. It's usually an acute mechanism of injury that people can relate it to.
What are some of the jobs that people have in everyday activities that you might not think are straining them but actually can lead to problems?
Actually, when we relate to carpal tunnel syndrome, for example, a lot of keyboarding type activity, it puts a lot of stress on the carpal tunnel. That's one of the major impact factors for a lot of people having that condition.
I got a really bad injury right here to this nerve in my elbow. I can't even do push-ups or lift weights anymore. What should I do?
Come see me again.
Okay.
Oftentimes that's affecting the ulnar nerve. At the
yes, that's what it is. It's the ulnar.
Yeah, and ulnar nerve.
Yeah.
Yep. And oftentimes we'll use a splint at first to see if that works. And we'll do, again, activity modification, but there's a surgery for that as well.
All right. I'd still be playing, though, if I was in the pros.
I'm sure you would.
Thank you, Doctor.
Thanks a lot.
Pride of Wrightstown. Good having you here. For more information on hand conditions and treatment options, visit baycare.net or email Orthopedics and Sports Medicine Bay Care Clinic at 920-288-5555. We'll also have all this information under our Wisconsin Tonight tab on NBC26.com. In today's tape.